Hi, I'm Dr. Francis Winski, and today we're going to take a few minutes to talk about what people call Mommy Makeover. What does Mommy Makeover really mean? Well, women who've had children have noticed that their bodies have suddenly changed. And most commonly what we're doing with a Mommy Makeover is trying to restore them back to an image that they had before children. So what does it consist of? It usually consists of some type of breast procedure, and that will either be a breast lift, known as a mastopexy, or it can be a breast augmentation, where we're making the breast larger. Now, commonly what happens is the breast will lose a lot of its volume during the course of pregnancy and breastfeeding. And so we really have to restore that volume, and that's done by using a breast implant. However, there are a small percentage of women who find that their breasts get considerably larger during the course of the pregnancy, and after the pregnancy they just seem to hang or become more sagging, and there we just have to do what's called a mastopexy or a breast lift. Occasionally we'll do a breast reduction in order to help shape the breast. So we go from the top, now we go to the middle section, which now has to be the tummy tuck. With the course of the pregnancy, the muscles on the front of the stomach have a tendency to relax and become a little less firm. There's a gap between the muscles, which we call diastasis, and after the pregnancy, that gap should go away. That gap occurs by the hormonal changes of pregnancy to allow for the developing fetus. However, after the pregnancy, and we still have that gap, it just makes our stomach look big and full and not have very much tone. Also, we tend to have some extra skin, a little bit of stretch marks sometimes at the lower part of the stomach, and those are the things that people really don't like. So with a tummy tuck, we can reconstruct the muscle wall and get rid of the extra skin, tightening up the appearance of the abdomen. The third portion of Mommy Makeover tends to be the thigh area. And here we have a little fullness that develops generally from the weight gain of the pregnancy in what we call the saddlebag area. And so a lot of times we'll incorporate some liposuction in that area to help thin down those regions and then help to redefine the hip and waistline areas. So most women will go through either some components of this, whether it's one, two, or all three of them, in order to reestablish their pre-pregnancy appearances. More times than not, some of these procedures are done jointly. Occasionally some patients want to proceed step by step through the procedures, and that will take a little longer to get those things accomplished. The most important thing about a Mommy Makeover is that it helps you regain your appearance that you had earlier in your life, and what we find is it makes you feel really good about yourself and that your body is back to the way it used to be.